Think about a pathway through the woods that's been walked for years. The brush, twigs, and shrubbery have gradually beaten down and worn away. What started as a small trail has now become a large, clear pathway to follow. Now, if you were standing at the edge of the woods trying to get to the other side, you would always choose this path without too much thought. It's been walked so many times, it's the easiest way to get across. This is what happens in your brain with chronic pain. Over the years, your brain has walked the pain pathway so many times that it's now a wide, clear trail. And now, every time your brain encounters a sensation, a painful one or not, it automatically chooses that well-worn path straight to pain. It's become the default route. Your brain has essentially been programmed over the years to continue to take this pain pathway, whether it's the appropriate response or not. But here's the good news. Just like how your brain has learned to take this pain pathway over time, it can learn to build new trails. It can be trained to take an alternative pathway through the woods, one that does not trigger a pain response. My name is Lisa Jasper. I'm a researcher, clinician, and an educator, and I hold a PhD in rehabilitation sciences. My career started as a physiotherapist, working with patients who, by all accounts, should have been getting better. Their injuries had healed, but like a lot of people watching this video, their pain remained. My colleagues and I were frustrated that they weren't getting any better, even while doing everything I and other healthcare professionals had suggested that they do. That frustration and deep-seated need for answers motivated me to go back to university to get my master's degree and then my PhD. What I now know through my research and clinical practice is that the brain is not a fixed static organ. It is a dynamic, living system that is constantly rewiring itself based on our experiences. So in this video, we're going to do two things. First, we'll look at the research that proves the brain is not fixed and can be changed. Then secondly, and most importantly, I'll give you evidence-based steps you can start to immediately take to direct your brain's neuroplasticity and reduce your pain response. So let's start from the beginning. What is neuroplasticity? Neuroplasticity is the brain's ability to change, adapt, and organize itself throughout your life. It's the process by which your brain forms new neural connections and pathways in response to learning, experience, and even injury. It makes sense. Every time your brain learns something new, the brain should adapt and change in response to this new data. Every time you have an experience, your brain physically changes. New connections form, old connections weaken. This is neuroplasticity in action. But here's the thing. Your brain doesn't just learn positive things. It can also learn pain. When you experience pain repeatedly over weeks and months, your brain starts to build very efficient neural pathways for that pain. You can think about this like a vinyl record. When the record gets scratched, the needle gets stuck in that groove and plays the same few seconds over and over. That's what's happened in your brain. Your nervous system has a scratch, a deep groove that keeps playing the same pain signal on repeat, even though the original injury has long since healed. In chronic pain, your brain has walked this pain pathway so many times it's now the default route. Whenever it needs to respond to a sensation, it sees that clear pathway and takes it, leading to pain. While the neurons that process pain also become more sensitive. The areas of your brain that process emotion, memory, and threat detection become intertwined with the areas that process pain. This is why stress can make your pain worse. This is why thinking about a painful movement can trigger pain even before you move. Your brain has learned to predict pain, and in doing so, it creates it. But here's the most important and hopeful part. Neuroplasticity works both ways. If your brain can learn to amplify pain, it can also learn to turn it down. If your brain can build that efficient pathway in the woods, it can also let that pathway fade and build a new, healthier pathway 15 feet over that does not lead to pain. There's a concept in neuroscience that says, neurons that fire together wire together. When you repeatedly activate certain neural pathways, they become stronger. But there's a flip side. Neurons that don't fire together don't wire together. So when you stop using a pathway, it weakens, it fades. And this is how we can help your brain unlearn chronic pain. So let's briefly look at some of the research that backs this up and provides so much hope. Dr. Lorimer Moseley, one of the world's leading pain researchers, has conducted studies showing that when people with chronic pain undergo pain neuroscience education, so simply learning how pain works, their pain levels decrease. Just understanding that pain is not a reliable indicator of tissue damage can start to change the brain's response. Another study published in JAMA Psychiatry looked at a treatment called pain reprocessing therapy, which is based entirely on neuroplasticity principles. After just 4 weeks, brain scans showed actual changes in how their brains processed pain signals and participants saw a noticeable decrease in their pain levels. Dr. Michael Moskowitz, a psychiatrist who himself suffered from chronic pain, developed visualization techniques based on neuroplasticity. He taught people to actively visualize their brain's pain centers shrinking and their healthy brain regions growing. And it worked. Brain imaging confirmed that these visualizations actually changed the brain structure over time. So let me be clear, this is not woo-woo treatments or unproven alternative medicine. This is neuroscience that has just been discovered in the past few decades. And for people living with chronic pain, it's one of the most hopeful pieces of research. Its principles have the power to give your life back. So now that you understand what neuroplasticity is, let's talk about how you can use it to reduce your pain. So how do you actually start retraining your brain? What can you do to improve your life when you're living with chronic pain? I'm going to give you 4 foundational steps that you can begin implementing today. The first step is to deeply internalize and understand what you learn in this video. This is important. By just understanding this alone and not even applying the other principles in this video, you can find relief. Your brain needs to understand that pain is not a reliable measure of tissue damage, that the hurt your body is feeling does not mean it's getting harmed. Now, I want you to spend time this week actively thinking about and reviewing this information. Write it down before bed, say it out loud. Visualize your brain's pain center shrinking as Dr. Michael Moskowitz had his participants do in his study. When you feel pain, remind yourself, this is my alarm system being overprotective. This is not damage. I am safe. Research shows that this cognitive reframing alone can start to reduce pain levels. You can even create a simple mantra for yourself whenever you feel a pain response. Something like, my pain is real, but it's not a sign of harm. My brain is learning to feel safe again. Repeat this daily. As trivial as it may feel at the moment when you're experiencing a lot of pain, by repeating this to yourself and really internalizing it, you can help your brain rewire the way it looks at your pain and decrease your symptoms. The second step is practicing sensory retraining. And this is about teaching your brain to reinterpret sensations that it currently labels as dangerous. So we're going to use a technique called graded activity. Start with a movement or an activity that causes mild discomfort, not severe pain, but something your brain has learned to fear. Maybe it's bending forward or reaching overhead or sitting for more than 10 minutes. Choose something. Here's the key. You're going to do that movement slowly, mindfully, and while actively telling your brain that it's safe. As you move, say to yourself, this sensation is uncomfortable, but it's not dangerous. I'm teaching my brain that this is safe. By doing this movement for just 30 seconds to 1 minute, once or twice a day, over time, your brain will start to reclassify that movement from threat to safe. You're training your body that movement is safe, and when it feels that sensation, it doesn't need to trigger a pain response. Step 3 is to calm your nervous system. In previous videos, we've talked about how people with chronic pain have a sensitized nervous system, meaning your body is more likely to interpret everyday sensations as threats. To improve this, you need to learn how to work with your body and incorporate habits into your daily routine that activates your body's rest and digest system, what we call the parasympathetic nervous system, and calm your nervous system regularly. One of the most powerful ways to do this is through deep diaphragmatic breathing. So here's a simple practice. Sit comfortably, place one hand on your belly, and then breathe in slowly through your nose for a count of 4, letting your belly expand. Hold for a count of 4, then exhale slowly through your mouth for a count of 4 to 6. Repeat this for 2 or 3 minutes, and then do this practice twice a day, once in the morning and once before bed. This can be frustrating at first because for years your body has been so used to being on high alert, but with regular practice, it can become much easier. There are lots of great resources online that I find helpful that can help you with guided breathing. Over time, this practice helps reduce the baseline level of nervous system activation, which in turn reduces your body's pain response. And now step 4 is to visualize your brain healing. Bear with me on this one, as it might sound a little unusual or woo-woo, but research does show that mental imagery can actually change your brain's structure. And here's how to do it. Find a quiet space, close your eyes, and then visualize the pain processing centers in your brain. Imagine them as overactive, glowing red areas. Now visualize these areas slowly dimming, shrinking, and cooling down. And then as you do this, you can say to yourself, my brain is changing, my brain is healing, I'm building new pathways. Do this visualization for 5 minutes a day. It might feel strange at first, but your brain can't distinguish between real and vividly imagined experiences. By doing this mental imagery, you're building new neural pathways. These 4 steps are your starting point. They are simple and may feel like small steps towards a big problem, but by implementing these 4 things into your routine, you're actively building new trails through that forest we've talked about. That pain pathway will soon start to grow over, and you can change that default route so everyday sensations result in less pain. Now, I know the question on your mind is, how long do I have to do this before it starts to work? As many of you know already, there are no quick fixes to chronic pain. The answer is that it's a process. We are actively reshaping how your brain interprets pain, but the research does give us some hopeful timelines. Across the board, studies on brain retraining programs show a consistent theme. Meaningful change typically happens after about 8 to 12 weeks. For example, research on programs like Mindfulness-Based stress reduction shows that after just an 8-week program, participants reported significant, lasting improvements in their pain, mood, and their quality of life. And again, this is by no means a magic cure, and I'm not here to make unrealistic promises, but these strategies are about fundamentally changing your brain's relationship with pain through consistent effort, and the timeline won't look the same for everyone. Here's one of the most important things I want you to take away from this video. None of this works without consistency. If you've been dealing with pain for years, these strategies may feel trivial or like small steps. But the reality is that the evidence consistently shows that by following these steps consistently, it can have real impact on improving your symptoms and allowing you to do more of what you want to do. Think back to our trail analogy. A path is not created by walking it once. In fact, the first few times are going to be the most work. You're going to have to beat down bush, you're going to have branches hitting you in the face. But after traveling that new path and walking on it every single day, it will become an easy path to follow. Neuroplasticity is not a passive process. Like building a new path, it requires daily participation. These 4 steps are not just exercises to try once. They're practices to be integrated into your life. 5 minutes of visualization a day. 2 minutes of deep breathing twice a day. Reminding yourself that you're safe every time you feel a pang of pain. So let's bring this all together. You've learned that your brain has an incredible ability to change called neuroplasticity. And you've learned that the same process that allowed your brain to learn pain can be used to help it unlearn pain. Like all treatments for chronic pain, this is not a quick fix, as unfortunately, despite what you might hear, there is no effective quick fix for chronic pain. I understand that our brains naturally want to find an easy solution and the path of least resistance when getting better, of course. But when living with chronic pain, we do need to acknowledge that getting better does take time. It requires consistent practices of the strategies we share in these videos. I want to conclude the video with this. You're not broken, your pain is not permanent, your brain can change, and you have more power over your healing than you've been led to believe. If this message resonates with you, I invite you to subscribe to this channel and share it with others who may also benefit. I'll see you in the next video.